Ali, let me take a minute just to introduce you, if you don't mind, to everyone while we're in a little bit of a break here, okay? Um, so, uh, we have a number of really key team players. They talk about a village and an army. um, Allison's one of part of our army. She's one of our superstar physical therapists. Remind me, we keep adding therapists. So, how many physical therapists do we now have?
We have four
So
physical therapists.
yeah, that's an incredible number, and that's just at our Fix Institute clinic,
It's a lot for
and
our
that's
small
only
clinic.
part of the team actually. Led by Lisa Warren. Well, Allison Krauss has been with us for quite a while now. Did her training at Ithaca, and eventually decided to do neurological physical therapy. And maybe she'll talk about this in her presentation, really, but not all physical therapists are alike. So some specialize on orthopedic issues, and others specialize on neurological issues like stroke and Huntington's disease in particular, and Parkinson's. And we kind of try to steer you guys to these specialized therapists who are a bit more familiar with the various neurological issues that go along with a complicated disorder like Huntington's disease. Um, that is Ellie. She's been with us for quite a while, and worked with many of our patients. And a lot of you probably see her pushing you very hard to exercise and stay fit, a key part in Huntington's disease. And we are so pleased to have her talk about supportive therapies and staying active. So I'll let you take it away.
Thanks. Yeah, and I think you're right. I think one of the biggest things we can do for our people with Huntington's disease is plug them into the neurophysical therapist around their area. So sometimes that's harder to find than your standard orthopedic people who maybe you've gone to in the past for knee pain or hip pain. But a physical therapist who knows what Huntington's disease does look different. Their interventions are different and how they treat you is different. So I do think it's important to not only have physical therapy be part of the Huntington's disease team, but more specifically a neurophysical therapist in addition to a neurooccupational therapist. So I broke this talk up into what we can do in rehab for Huntington's disease specifically, and then more along the lines of what activities you can start today that doesn't require a skilled physical therapist in the beginning, and how you can consult them along the way. So Huntington's disease rehabilitation has grown over the past years, 10 years or so, even 20 years, with research in this area and how physical and occupational therapy can play a role from the time of before symptoms maybe start and before symptoms affect your motor components up until the very end and being more palliative and supportive care. So just because you're not falling or just because you don't think Huntington's disease has affected your walking doesn't necessarily mean that you don't need physical therapy yet. Trying to get them as part of your team from the very beginning is an important part of this disease progression. And I'll show you some different ways we can be a part of your care throughout the years. So I would neglect the rest of my team, like Dr. McFarland said, if I didn't mention I'm just one member of your rehabilitation team. And so occupational therapy has a huge role when it comes to managing Huntington's disease. They can help with activities of daily living. They can help with energy conservation. They can help with sleep. I think OTs are a great part of our team. And a lot of patients will say, well, I don't need occupational therapy. I'm not working anymore, and it doesn't have anything to do with your work necessarily. It has a lot to do with how you go through your day, how you dress, how you bathe, how you manage your energy if you're getting too fatigued by the end of the day. They can even send people in to do some home safety assessments. So if you have not seen an occupational therapy yet in your progression of the disease, it's an important person to kind of add to your team. Speech therapy is just as important. So our speech therapist here can look at your cognition. They can look at your swallowing, which is really important when it comes to Huntington's disease. You can have a swallow evaluation and they can review what they found on the scans of whether or not you need to modify your diet or different tips they can give you to help maintain a safe swallow. And they also talk about the importance of oral hygiene when it comes to Huntington's disease and how much impact that can have on your long term health with the disease. And then getting respiratory therapy involved. Our speech therapy kind of crosses over in this area, but using inspiratory muscle training and expiratory muscle strength training is actually has a lot of research in the area to help patients with Huntington's disease. So when do you start the rehabilitation process? We at the Fixell Institute and a lot of neurophysical therapists around the country would like to see you from the time of diagnosis. Even if you're not having physical symptoms or motor symptoms, we can obtain some baseline measurements. So we can look at your walking, we can look at your balance, and then over the years, if you do develop some motor symptoms, we can compare you to you. So we're not comparing you to any other standards or any other people. We're comparing you to how you were 6 months ago or a year ago, and we can tell you whether there's been a functional decline. We can also educate you, and you'll see that a lot as I continue on in this presentation about the different types of exercise and activity, whether it's physical or cognitive, to get involved in from the beginning of the diagnosis to maybe push off some of those functional impairments or mobility limitations that can come on later on in the diagnosis. And we can establish and progress a home exercise program that's specific to you. Maybe you've had knee pain in the past or back pain, and so your standard exercise doesn't work for you. Well, let a physical therapist find some exercises that do work for you from the beginning so that we know how to modify it as we go on. And then depending on what stage you're at in the disease and what your needs are, we can really change up how frequently we see you based on what we think you need and based on what you think you need. So we would like to see you once every 6 to 12 months, just again to reassess those measurements and see if there has been a change. If there's been a change, let's get on top of it right away. If there's not, then we'll send you home with the same exercise program we previously gave you, and we can check back in another 6 months to a year. If additional services are needed, then let's start them right away. It's kind of more of a preventative model rather than waiting for falls or waiting for difficulty getting up and down from chairs. Let's see you throughout the disease process to maybe push off those impairments a little bit more. We can, if you have had a decline in some of the balance tests that we do or some of the walking tests that we do, we can pick you up for treatment or find a local physical therapist that knows Huntington's disease and they can pick you up for treatment. They can work on balance and walking or whatever you need right then, maybe to push off some of those risk for falls. And then once you get going, and maybe after 8 to 10 weeks or so, we can drop the frequency and drop it to one time every other week or one time a month, just to kind of stay on top of everything and ensure that we have had, you've understood the rehabilitative goals that we set initially, and then how to maintain those over time. So Medicare and other insurance companies have approved of maintenance physical therapy and maintenance occupational therapy as it relates to Huntington's disease, because it's a progressive neurological condition. And this is really good for our patients who need services throughout the year. So just because you hit your Medicare cap or you've hit the amount of visits that is allowed doesn't necessarily mean you have to stop therapy. And this applies to home health, it applies to outpatient, it applies to skilled nursing facility. We can now set goals to maintain your function. Insurance companies are understanding that if we maintain your function over time with a progressive condition like Huntington's, it's a win. And so we can set, we don't have to show rehabilitative or improvement goals in your function. We can show maintenance goals, and we can also show a slowed progression of the disease. So we know the disease, unfortunately, is going to progress, and we can just show that we're trying to make it progress slower. And that can be our goal for physical therapy, and it justifies additional treatment. So how does physical therapy look different at different points in your disease progression? So this is, like we said, we want to break it up into preventative, which is the beginning or early stages, maybe even before motor symptoms really affect your function. Restorative, so that may be when your function starts to have a little bit of balance or walking changes. And then even supportive towards the later stages of the disease when we're looking at wheelchairs. And different ways for caregivers to stay safe and keep patients safe and healthy during these later stages of the disease. So from the time of diagnosis, your physical therapist can assess your strength, your balance, your walking, your coordination, and really identify if or where your mobility problems are affecting you and design a program that's going to be most specific to you. Early on in the diagnosis, we know that there's a lot of benefit to aerobic and strength training. So aerobic being cardiovascular, getting your heart rate up, strength training being more isolated muscle strengthening, and performing these exercises 3 or 4 times a week to try and delay the onset of those mobility restrictions. So we know if you get diagnosed with Huntington's disease and then you sit for a longer period of time, mobility restrictions will come on faster. So if we can educate you on some aerobic and strength training activities to slow the progression or push off the mobility restrictions, then we're doing a good job from you from the beginning part of the disease. Unfortunately, as we know, the disease does progress. And so getting into that restorative phase of the disease, we need to find ways to maintain your function. And this could be the stage where your balance may be affected. Maybe it's harder for you to get up and down from chairs, excuse me. Maybe it's hard for you to get in and out of bed or to get up and down from the floor. And so this may be a time that we increase the visits or the amount of the frequency that we see you in clinic, and we work specifically on your needs. And so there is more and more research with Huntington's disease and physical therapy on the benefits of gait training and the benefits of balance training, and even teaching you safer ways to get up and down from a chair so that your caregiver is not having to lift you. And so you're decreasing your caregiver burden and you're maintaining your independence so that you're improving your overall quality of life. And then in the middle to late stages, we can be an additional support. You're going to need a lot of support at these stages. And so let your rehab team be part of that support. This may be part of the time where we switch maybe to a home health physical therapy and occupational therapy, where they can see what your house setup is. They can help with home assessments and grab bars and transfer benches and 3-in-1 commodes that may be easier. So allowing physical and occupational therapy to come into your house at the supportive stages or the later stages of the disease is helpful to maintain your function overall. Physical and occupational therapy are also a big part of the wheelchair assessment, making sure that when you get the equipment that you need, and that you're using your insurance money for the most appropriate way that they can provide you. So getting a Broda chair approved for Huntington's disease can be really important. Maybe at this stage, we're teaching the caregivers more how to do passive range of motion to maintain the mobility and that prevent contractures or secondary complications that we know can be affected by the decreased mobility in patients with Huntington's disease. So in that restorative phase of the disease or the middle stages of the disease, we know research over time has showed that one-on-one gait training with a neurological physical therapist can actually help improve people with Parkinson's walking speed, and it can improve their quality of their walking. And so not just going out for a walk every day, but getting that one-on-one session maybe once a week for 8 weeks can help improve the walking quality of people with Huntington's disease. Same thing for balance training. We actually know that in the restorative phase of people with Huntington's disease, we can improve their balance through one-on-one physical therapy so that the person feels more stable during their activities of daily living, whether it's brushing their teeth, washing the dishes. If we can improve their balance through one-on-one training with a physical therapist, then we know that their balance and their confidence during their day in their balance is going to improve. And then maybe more towards the restorative to supportive components of the disease. Physical therapy can help make adaptations to your daily routine to make it easier. So we can add weight to a walker is sometimes really helpful for people with Huntington's disease. We can make sure you have the right kind of walker, that it's set for the right height for you. We can make sure that you have little adaptations throughout your day that maybe help prevent falls. We can talk about night lights. That's important to go. If you're going to go to the bathroom in the middle of the night, walking from your bed to the bathroom, we need to have it well lit and we need to have it open and not things that you can trip over. Maybe we need to talk about using a walker specifically at nighttime to prevent a fall, because we know that's an area that has a lot of falls. We can also show you some different adaptive equipment, and occupational therapy is really good at this component, but even something like a bed rail to help you get in and out of bed independently and it goes under your mattress and you can buy it on Amazon for relatively cheap. And it just is one less thing that your caregiver has to do and something you can now maintain your independence with for a longer period of time. So depending on what stage of the disease you're in the early stages, we're going to work on exercise capacity and increasing your performance. And we're going to work on strength training and aerobic exercise. In the middle stages of the disease, we're going to work on maybe your cognition has started to decline a little. So let's work on more sequencing tasks. Let's work on planning out how to get up and down from the ground. Let's practice that. That is a motor task that takes a lot of sequencing in your brain to figure out how do I get my body to do what I want to do. And that's something that if we start planning on in the middle stages of the disease, you'll be able to do it for a longer period of time. Again, in those middle stages, we can work on mobility and balance and prevent falls. We can help decrease deconditioning, right? So if I can keep you active more with a home exercise program and decreasing your falls, the chances that you're going to have secondary complications from immobility go down. We can work on respiratory function, and breathing is a part of physical therapy to work on it while you're in sitting, but also while you're doing activity. Improving your posture and working on your strength in your postural muscles, even in the middle to late stages of the disease, is really important. And even in the later stages of the disease, we can look at your seating, how you're sitting. We can add bolsters, we can add wedges, we can add cushions to try and get you in the best position possible to improve your postural alignment and improve your respiratory function. And then also that palliative care. So maybe that means teaching your caregiver how to do passive range of motion and stretching to prevent contractures with this disease. So that's all the physical therapy, rehabilitative components of the disease. And like Dr. McFarland said, trying to make sure that we get a neurological physical therapist involved in people with Huntington's disease is really important. Let us find you a neurological physical therapist near you, because it will make a difference versus going to somebody who you've previously gone to for back pain. And don't be afraid to get occupational therapy and speech therapy involved. They have a lot to offer from the beginning parts of the disease as well. So then shifting gears into exercise and activity, and what you can do now to keep you active now and as well in the future. So this was actually developed by the HDSA as well as the European HD Network, Cardiff University, and then a network of physical therapists. And what they did was they developed different ways that show you how you can get moving and how you can stay moving with Huntington's disease. So it talks about the general exercise and activity benefits for patients with Huntington's disease. We know staying active and exercising can help improve your general health benefits. It can help improve your sleep, which if we improve your sleep, we're going to help improve your fatigue during the day. Activity benefits can help manage your anxiety and depression, which is going to overall improve your quality of life. And then specific for Huntington's disease, we know that exercise and activity can help improve your confidence in your balance. Maybe taking a Tai Chi class can improve how you are in your center of mass and how you know you have a better understanding of how your body moves. And so you're going to have more confidence during your daily activities. You can improve your mobility. You can improve your flexibility. Stretching can be really important with this disease. We can maintain or improve your independence if we can get you a little stronger or maybe improve your posture. And then just improving your posture is going to improve your breathing. So just getting more active, whether it's a fitness component and you like to ride a bike or go for a walk or do some strength training, or maybe just moving more outside, finding adaptive ways to stay active with gardening or painting or dancing or going to see family and staying socially engaged or fishing. It's just as important to stay physically active with your leisure activities that you've always liked to do as it is to do a formal exercise program. So our goal through rehabilitative services is to set you up for success in this area. But if you're starting out on your own, this same group also developed a program that you can use to kind of set some goals and maybe make that New Year's resolution a little bit more likely, because you can set how you will do it, where you will do it, what do you need to help get you to do it, and some ideas for what you see is good. We know aerobic exercise and strength training is good for people with Huntington's disease, but if you don't like to ride a bike, then riding a bike is not a good exercise program for you. If you're somebody who likes to go work on a farm and be outside, then that's the exercise and activity that we need to keep you doing to keep you active in the long run. So I thought this was a great form to include in this presentation as a way that you can have a takeaway from this presentation on something to get you started now with activity and exercise that is personal to you, and it will be the most successful if it is personal to you. When it comes to what the research has shown, there is different levels of evidence, different levels of strength in what our research has shown so far. And so we know that research has shown that aerobic exercise and strength training and task-specific training of functional activities are the most studied and most effective ways to help patients with people with Huntington's disease. So we know aerobic exercise, which is getting your heart rate up. So the research in Huntington's disease is actually 55 to 90% of your heart rate max, which if it doesn't mean anything to you, it means it's a lot. You can get your heart rate pumping pretty fast, and the benefits of that with Huntington's disease are there. It can improve your motor function, and it can improve your aerobic capacity when it comes to Huntington's disease. So getting your heart rate or working at a level where you feel it's challenging or even hard is where we want to be for aerobic exercise. So maybe you're riding a stationary bike and you're reading a book at a low level. That may be down where it's really easy or even easy. That's good for your mobility, but you're not getting the aerobic benefits that we're looking for that we know can help with your motor function and your exercise capacity with Huntington's disease. So we want to try and get you into that 5 to 7 range out of 10. So you're challenging or it's hard for you in little bits at a time. And this is something that a neurological physical therapist will know and will try and teach you how to do it and how to monitor yourself during it to make sure that you're doing it safely and effectively to get the gains that we know are good for Huntington's disease. The goal for aerobic exercise and strength training is 3 to 4 times a week at a moderate intensity for 20 to 30 minutes. So this could be going for a walk for 20 minutes. It could be riding a bike. A lot of people with Huntington's disease like the pool because you don't have to worry about your balance as much. So maybe walking back and forth in a pool where you're getting your heart rate up. It can be a stationary bike. It can be a group exercise class. Something that gets your heart rate pumping a little bit more is going to be important for the disease. Strength training is the same way. I find that people with Huntington's disease do well with strength machines. So I know it's tough right now to go to a gym, but when we are safe to go back to a gym, using strength machines can be safer because you don't have to worry about lifting up free weights or dropping free weights. So if you have the machine, then you're in a safer spot and you're seated, so you don't have to worry about your balance as much. And then task-specific activities for functional activities. So that's exactly doing sit to stand transfers. If you have a chair up against a wall and you do sit to stands and you do 10 of them in a row, your heart may be pumping a little bit faster. And so we're getting that aerobic exercise up, which is important. And we're also doing a functional task. I tell people with Huntington's disease that it's strength training. It keeps the muscles in your legs strong. It's functional. You have to be able to do it for the rest of your life. And it's a little bit of balance, right? It works on that forward and backward balance that we know is sometimes harder as the disease progresses. Some of the other things that have been studied and have okay evidence behind them is balance training and fall prevention. And so this goes back to that maintenance program. If we can see you in physical therapy before you have falls and work on the things that are hard for you for balance, we can maybe push off the falls or decrease the frequency of falls, which we know is an important component of the disease. The respiratory training has also been studied in the Huntington's disease population, and it's been proven to be effective in improving breathing function and capacity. So this may mean making sure that you have that speech therapist or respiratory therapist as part of your team is an important part from the beginning of the disease. And then some expert consensus that we have learned over the years is we know that postural changes can be affected as the disease progresses, but some physical therapy or occupational therapy intervention to address these can be helpful throughout the years. Transfer training, whether it's the person with Huntington's disease that is doing the transfer training, or the caregiver of the person with Huntington's disease that's doing the transfer training, can be helpful to prevent falls and to also decrease caregiver burden over time. And then along that same lines, down the line, palliative care. So teaching the caregiver how to help stretch the patient, or the best position to put them in with using wedges and bolsters to prevent contractures with the disease. So it's easy to say that exercise is good and just go exercise, but some people do and some people don't. So what have we known over the years to help what works and what doesn't? So what we do know that works is, we know if the patient believes that what they're doing is going to help the outcomes, then they're more likely to do it. So they need to believe that they can complete the task, and they need to believe that it's going to be beneficial for them. And so sometimes that caregiver or family member that's telling them you need to exercise, you need to exercise, you need to exercise, may not be the answer. Maybe it needs to come from a physical therapist or another person with Huntington's disease, to try and show them what has worked for them in the past, or how can they be successful at this task. The research does show that if the person with Huntington's disease has the support of the caregiver, they are more likely to stay within a program and to get the benefits out of the program that they need. Setting a schedule. This is a big one that we talk about in rehab. So you're a lot less likely to miss a doctor's appointment because it's on your calendar. So maybe we need to set a plan to how you're going to incorporate exercise or activity into your schedule during the week. Maybe on Monday you have 3 doctor's appointments, so let's not do exercise on that day, but Tuesday looks clear. So pick a day and pick a time. So maybe Tuesday at 9 a.m., we're going to do our aerobic exercise or our strength training that was prescribed by a physical therapist. Set it as an appointment in your calendar, just like you would for a doctor's appointment, and you'll be less likely to push it off. We know that group exercise actually works better than individual exercises. So that's hard during COVID times, but trying maybe some Zoom meetings for exercise or activity can be more beneficial and keep you more engaged than just trying to be on your own with just your caregiver or your family member. And then we know that people with Huntington's disease who had availability of DVDs or online videos were more likely to stick it out. And so at the end of this, or the next slide, I have some videos that can get you started. There's a lot of resources online, and the HDSA has created some newer ones recently that can help try and get you moving in your home setting, that you don't need to leave the house during this time of COVID. What we know doesn't work, or is harder to get people to stay active when it comes to Huntington's disease, is cognitive impairments and lack of motivation. And these are 2 things that unfortunately is not the person, but the disease, right? We know the disease causes cognitive changes, and we know the disease causes lack of motivation. And so those 2 components together are going to make this challenging to stay active throughout the disease. And again, if it comes from more than just your family members, and we can, as a rehab team, address the cognition and address the lack of motivation, and maybe use that previous slide with the information on how to keep active, we'll be more successful when it comes to managing activity and exercise down the line. So these are some videos online. These 2 down here are links that I can post, that have been posted by the HDSA. One of them is an exercise guideline. So it walks you through just stretches that you can do at home on your own, like a piece of paper. They're very generalized, and they were produced by the HDSA as safe and effective for people with Huntington's disease. And then they also actually put out a move to exercise video that is on their website that starts you off. It shows options in sitting, and it shows options in standing, depending on what level you're at, to find ways to maintain mobility. So moving your shoulders, moving your arms, and doing functional activities. But we don't have to stick to just that, right? Especially in those preventative years, in the early to middle stages. Excuse me. We need to find things that are going to keep you active long-term for the disease. And that might mean being a little bit more creative with what's online. Excuse me. There's some programs online that are appropriate for people with Huntington's disease. So this is called Power, or PWR exclamation point, and they are all videos on YouTube, and they show different positions. So you can do it lying on your back, you can do it lying on your stomach, you can do it seated, you can do it standing, you can do it on all fours. And so the idea being, if we can keep your body moving, not just your arms and your legs, but your trunk and your rotation, we're going to maintain your mobility for a longer period of time. This is actually from the National Parkinson's Foundation, but I have provided it to some of our people with Huntington's disease because it's a lot of variety and exercises you can do from home. So it's called Fitness Friday, and it's through the National Parkinson's Foundation. And they've released videos of exercise videos during COVID that are appropriate for people with progressive neurological conditions to perform from home. And again, you can scroll through the videos. Some of them may be really challenging and work more on balance and coordination, and others are really easy. And you do a series of boxing and sequencing from the seated position. But this engagement that happens more when you're watching a video and copying somebody may attack more of that cognitive component that we're looking at, more than just going for a walk or riding a stationary bike. And same thing, this is a guy named Curtis Adams that actually a patient told me about. And he does really interactive videos. He does them from the sitting position, but also standing, incorporates music, and does it more for just people with mobility difficulties. And he's on YouTube as well. So there's a lot of free resources out there that are available for people with Huntington's disease, that may help them stay active throughout the disease progression. And your activity may change, right? In the beginning of the disease, maybe we push a walking and a balance program, but as the disease progresses, you need to know, okay, where should I be now and what should I be focusing on now? And that's where a neurological physical therapist can really help figure out what's the best and most appropriate exercise platform for you right now in the stage of the disease, and check back in with you for that every 6 months to a year. And then, like we have stated above or previously, we know that mood is one of the negative things that causes these programs to not be successful. So how can we address mood with Huntington's disease? So there's a Tai Chi program or even a boxing program. And these may be a little bit more calming, like Tai Chi, or get your anger out, like boxing. I have some people with Huntington's disease who have participated in the boxing programs in the past and have really enjoyed them and benefited from them. Hitting things can take out some anger that you may have against this disease, and it makes you feel good, and it's aerobic exercise, and it gets your heart rate up too. If balance is something you're worried about or something you want to work for, working on a Tai Chi program, whether it's specific for people with Huntington's disease or something online that you found. It works on your center of mass, and it works on that deep breathing that we know can help with maybe some mood issues that are affected by Huntington's disease. Music is really a good way to combat mood. So if we know that we want you to walk to help with your Huntington's disease, then maybe playing some upbeat music to get you in a good mood when you're going to walk can help. And on the opposite end of the spectrum, if we want to do some yoga and breathing components or postural education, maybe we bring in some calming music. And music can help a lot with mood and attention when we're talking about exercise and activity with Huntington's disease. And lastly, there's more and more apps these days on anxiety and stress, and they can be used to help with your stress and anxiety from Huntington's disease. So Calm is a common one that has been around for a while now, and Headspace and meditation can sometimes help with that mood that we know is affected from Huntington's disease. So hopefully I gave you some resources that you can take away from you now. And if you don't have a rehabilitative team as part of your care team, then try and find one in your area, because they can be a great resource for you in the beginning, in the middle, and the late stages of this disease. Let me see if there's any questions. So one of the questions was, when can I know that the HD patient won't be able to walk alone? That's a good question. I would say this is a great question to have the physical therapist assess in person, making sure there's different ways that they can walk alone, right? Walking alone without an assisted device is one thing. Walking alone with a walker, or with maybe some support can allow the patient to walk a longer period of time without being being in a wheelchair for as long as possible. I would say let's try and keep people with Huntington's disease walking safely as long as possible. So this may mean that we first implement some of the assisted devices to keep them walking. Maybe we then walk only with caregiver nearby to prevent falls. And that can allow the person with Huntington's disease to walk for many more years than just they're having a fall, let's put them in a wheelchair. Because we do know the benefits of walking and staying active as well.